What does your first session look like? Hi, my name is Jim Aguilar, licensed marriage and family therapist in the state of California and Texas. And here I am talking about topics in regards to therapy. So in regards to the first session with me as your therapist, this is what we're going to discuss. I'm going to introduce myself. I'm going to go over through some ground rules in regards to therapy, some of the policies, stuff like that. And that takes about like 5 minutes. And then I talk a little bit about myself, another 5 more minutes or less, and then you will do most of the talking. See, I like to understand the client as best as I can, especially in the first session. So clients are most likely going to do most of the talking. I'm going to ask questions such as, what brings you in? Very general. What brings you in? And then you tell me about what brings you in. What are your expectations for therapy? What is it that you want to work on? Because therapy has to be something that we're both working on together. It's not just me coming up with a plan for you. Is that you tell me, what are you trying to get out of this? Because maybe I'm thinking, well, we're going to talk about your family. But you're thinking, no, I don't want coping skills. I just want reasonable coping skills. So that's where we got to be on the same page. And that'll be a little bit of the first session. Kind of understanding each other and knowing where we want to go. Anywho, that's something that I want to talk about today. Just a little bit of like an insight in regards to what the first session would look like. Again, trying to break down those barriers and boundaries in regards to what therapy looks like. And so it's not so intimidating or anything like that. Well, thank you so much for your time.